Womb cancer, also known as uterine or endometrial cancer, usually occurs in women aged above 50. It usually presents with abnormal menstruation or post-menopausal bleeding. The main risk factor is prolonged period of estrogen exposure, which can be caused by the following: nulliparity, late menopause, obesity, polycystic ovary syndrome, genetic predisposition to endometrial cancer, for example Lynch syndrome, and/or tamoxifen use. Sometimes endometrial cancer can be diagnosed unexpectedly during a hysterectomy done for other causes. How is the diagnosis made? Diagnosis is carried out by sampling the womb lining. This can either be done at bedside or under anesthesia, usually as a day surgery case through dilatation and curettage with or without hysteroscopy. The sample is sent for testing in the laboratory and the results will be available approximately 2 weeks later. Once the diagnosis is confirmed, your doctor will order investigations to help determine the extent of cancer spread to plan further treatment. This may be in the form of 1. CT scans of the thorax, abdomen and pelvis, 2. Whole body PET scan, or 3. An MRI of the uterus or cervix. Womb cancer staging is done surgically. This helps us to confirm the extent of spread of cancer to tailor further treatment accordingly, as well as to treat the cancer by removing the womb, which is the source of the cancer. Alternative methods such as radiation and fertility-sparing treatment with Mirena and oral hormonal medications are available on an individualized basis. Womb cancer stages. Stage 1 is when the cancer is confined to the womb. Stage 2 is when the neck of the womb or cervix is involved. Stage 3 is when the cancer spreads to the tubes, ovaries, vagina or abdominal lymph nodes. And finally, Stage 4 is when the cancer has spread beyond to other parts of the body. Surgery for endometrial cancer involves removing the uterus, ovaries and tubes, along with surrounding structures as necessary. Removal of omentum and lymph nodes may be required in some situations. However, removal of the lymph nodes is not without risk. Some complications of lymph node removal include lymph fluid accumulation in abdomen, known as lymphocysts, which can cause discomfort, become infected and require antibiotic treatment or drainage procedures, and/or lymphedema, which is swelling in the legs that can be long-term, severe and disfiguring, and may also lead to multiple episodes of infection of the legs known as cellulitis. Despite the complications, if lymph nodes are not removed, the cancer is not completely staged and there is a possibility of undertreatment. We know that in early-stage womb cancer, lymph node spread is less likely. This means that a lot of women will get normal lymph nodes removed and be subjected to side effects of lymph node removal. Hence, there is a compromise available known as the sentinel node biopsy. What is a sentinel node? Sentinel nodes are the first nodes to which the cancer cells may spread from a tumor. Sentinel nodes are removed to check if there are any cancer cells. If cancer cells are present, patient may require chemotherapy treatment. On average, a woman may have 10 lymph nodes on each side of the pelvis. Rather than removing 20 lymph nodes in total to determine if the lymph nodes have cancer, it has been found that removing one node, the sentinel node, for biopsy allows us to get a representative sense of the health of the lymph nodes on that side of the pelvis. How is a sentinel node biopsy done? After you are anesthetized, your surgeon will inject a dye into your cervix. A special camera is used to identify the sentinel lymph node, which is then removed and sent for testing. This is done on both the left and right-hand side of the pelvis. In the event that the sentinel node is not identifiable on that side of the pelvis, the lymph nodes on that side will be managed accordingly to your surgeon's discussion with you. It is to be noted that, specific to womb cancer, the clearance of all normal-looking lymph nodes are not required, even if the sentinel lymph node has cancer. This practice differs from that of some other cancers, like breast cancer. Thank you for watching this video. This video is presented by Yong Lu Lin School of Medicine's Department of Obstetrics and Gynecology. For more videos like this, head on to the National University of Singapore's website.